Who exactly is your surgeon? Medical mistakes during and after surgery kill more than 100,000 Americans every year. Medical experts say many of these mistakes can be prevented.
The nonprofit news organization ProPublica has released some unprecedented Medicare data. You can now see which doctors have complications following surgeries and how many they have.
Senior investigative reporter Stephen Stock is with us tonight. Stephen.
Raj, for the first time, you can now get an idea of how many surgeries doctors have done and how many complications they've had over the course of a 5-year period. It's performance data for 17,000 plus surgeons across the country. Tonight, we investigate why the publication of this data could be a game changer for the entire medical industry.
How are you? Should we roll those pant legs up so at least we know which one was done?
Orthopedic surgeon Dr. Stephen Howell does as many as 6 knee replacement surgeries in a day, 470 in a year, at the small Dignity Health-owned Methodist Hospital in Sacramento.
And then how far can you bend it? Let's see how you can bend it back.
During the last 2 decades, Dr. Howell has been especially focused on improving the outcomes and reducing hospital readmission rates for his patients after surgery.
Everybody's looking to try to reduce this complication rate.
In fact, Dr. Howell and his team published this research showing that shorter hospital stays after knee replacement surgery lead to better outcomes and fewer complications.
Well, I think complications are really sort of devastating for the patient and their family, and they're also devastating for the physician.
And according to an unprecedented analysis of Medicare data by the nonprofit newsroom ProPublica, Dr. Howell has what they describe as one of the lowest risk scores for surgeons in his field here in California.
And I think it is a decent way to make everybody accountable for what we're doing and trying to improve the care that our patients receive.
ProPublica's unprecedented analysis looked at federal Medicare billing data over a 5-year period involving 64,000 patients who were readmitted to the hospital due to complications following common elective surgeries. Nearly 3,500 of those patients died. As part of its analysis, ProPublica factored in the number of surgeries performed, the condition of the patient, and number of complications to create what they called a risk-adjusted complication rate for surgeons. Experts from Harvard and Johns Hopkins Medicine advised ProPublica on the data analysis.
We're actually seeing how well the patients do after we operate on them or give them certain treatments.
Dr. Marty Marcaray of Johns Hopkins was one of the advisors on the project.
For the first time ever, in a way that's groundbreaking, we are seeing a plethora of good data inform the performance metrics of doctors and hospitals in a way that we can understand.
The 8 common elective surgeries scored using Medicare outcome data were knee and hip replacements, cervical neck fusion, lumbar spinal fusion, both posterior and anterior columns, gallbladder and prostate removals, and prostate resection.
When you look at very standardized elective procedures, there's really very few times when anything should go wrong.
Ideally, the individual physicians, their professional associations, their boards of medicine can work together to share these data and say, how can we help each other get better?
Dr. Jay Wolfson of the University of South Florida's Medical School in Tampa is one of the country's leading researchers looking for ways to improve health care outcomes for consumers.
These data provide some insight into what we know to be oftentimes the extraordinary variation in process and outcome associated with health care.
While he agrees that surgeons who don't use this data to improve might want to find another line of work, Dr. Wolfson also warns against misusing the data analysis as well.
But I think we have to be cautious, Stephen, that we don't use this as a hammer, because when we start using publishable data that we obtain from medical records and we focus on the clinicians, we go back into the blame and shame game. We say, let's find somebody to blame for this and we'll burn them at the stake. You know, find the bad physicians and hang them up. We don't want to do that. We want to say our goal is to have a high-quality healthcare system where we can feel comfortable and confident in the care we receive, the hospitals we go to, and the physicians who are performing procedures on us.
Most doctors are doing the right thing and always will do the right thing, but there's a small fraction that are either responding to perverse incentives, uninformed, or exercising poor skill or judgment, and have atrocious outcomes.
I'll see you in a month.
But in contrast, Dr. Howe's low-risk score, according to ProPublica's analysis, shows he is in the top 3% of California knee replacement surgeons who perform this procedure on Medicare patients.
And we don't want complications. We want an easy recovery. We want them out of the hospital when it's safe, and we want them back to life.
Now, the analysis also allows patients to see statistically which of these 8 procedures carry higher risk, at least historically, among Medicare patients. For example, at least among Medicare patients, cervical neck spinal fusion was statistically less risky than any of the other 8 studied here. It's remarkable data. And you can go online to NBC Bay Area. We have a link that links you to the ProPublica data, and you can check out the surgeons for yourself.
And it tells you the surgeon's names and their statistics.
And where they work and which hospitals.
That's interesting.
Yep.
Thanks, Stephen.
Thank you, Stephen. If you have a tip for Stephen Stock or anyone else in our investigative unit, give us a call, 888-996-TIPS, or send us an email directly to the unit